What to expect during your first bariatric consultation. Patients often have a lot of anxiety about coming into office to see a surgeon. Oftentimes, the hardest part for starting your journey to weight loss surgery is getting in just that one time to see the surgeon. After that, everything falls in place, a lot of the barriers go away, and a lot of the anxiety goes away. A lot of patients say the hardest thing they can do is just to come in and meet with me and go over weight loss surgery. Once they've made that step, everything seems to fall in place and their anxiety level drops significantly. So what you can typically expect is normally before the appointment, patients are in touch with our patient advocate. The patient advocate will look over their insurance plans and go over their benefits and let them know if they're a candidate. On the day that they consult with me as the surgeon or a surgeon, patients will oftentimes meet with an in-house or an in-person patient advocate. They'll go over the entire process of the bariatric program, and then all other forms get filled out with that person, and any type of insurance requirements are reviewed at that time as well. Then there's a consultation with the surgeon, and during the consultation with the surgeon, we develop a relationship, and I get an idea of what the goals are that that patient has, what exactly they're looking for in having weight loss surgery. We look for any barriers to achieving those goals, and we go over really how the weight loss surgery works. We do a full history and physical, meaning we really thoroughly evaluate the patient, look for things that might cause a problem for having an operation. Then we go over how the surgery itself works. And typically, the consultation takes about 20 to 30 minutes. We go over the details of how the surgery works, the risks, the complications, and the physiology of how it works. We do touch on the diet plan as well. And then after that, there's a timeline we typically will give you, which goes through all of your insurance requirements that are generally out there for weight loss surgery. So typically, insurance companies have several requirements for weight loss surgery, and so we organize those for you through our patient advocate as well. And those requirements usually are things like visits with the dietitian. Usually it's about 3 visits to go over the diet around the time of surgery and for permanent dietary changes. A psychology consultation or evaluation or clearance is required typically by an insurance company. An upper endoscopy or an x-ray to see if your stomach is okay to have an operation for weight loss surgery. We have you meet with an exercise physiologist because this whole process really involves exercise in addition to dietary changes. And when I say exercise, I don't mean you're going to be pumping weights at the gym, but you can be. It's more to include regular activities that burn calories as part of your weight loss journey. And we like resistance training, whether it's with bands or lighter weights or whatever your preference is, but we have an exercise physiologist meet with you to go over different techniques that suit your needs. A lot of our patients have issues that would limit their exercise capabilities, and that's the job of the exercise physiologist is to figure out what works for you. And an example would be a lot of patients have bad knees or back, and so in those patients we do water aerobics. So there's a lot of different things that we do to try to figure out how we can get you to have more activity in life in order to help with your weight loss journey. We also include your primary care doctor frequently. So we will oftentimes have you get clearance from your primary care doctor, depending on your health condition. And then sometimes we have you see other specialists if there are other clearances, say from a heart doctor that we would need. We often screen patients for sleep apnea, and if we're worried they have sleep apnea, sometimes we order testing to rule out sleep apnea as well. So these are all the things you can expect with a bariatric surgeon consultation. If you'd like to hear more or meet with us at the office, please feel free to reach out to us at MIS Weight Loss Institute or subscribe to our channel.